So you're looking for help, and now's the time for action. We know this is a fatal chronic disease, so we want to act fast, but we want to act smart. And there's two main steps to this process. The first step is, how do we communicate with our loved one who has a problem? The second step is, how do we get them the help they need? Communicating with your loved one who's got a drug or alcohol addiction can be a little bit tricky. And the key to this is really expectations and setting a good plan. Now, for me and for a lot of people I work with, what's really helpful is writing this stuff out, getting a pen and paper, sitting down and coming up with a plan on paper, because you get a very small window of opportunity to communicate with your loved one and you want to take advantage of it. In this plan, what you really want to think about is, what does this loved one need and who his addiction is affecting. So ask people, ask friends, family, loved ones to chip in, maybe even write them a letter. The critical part is, when you talk to the loved one about their drug and alcohol use, you want to make sure it's not when they're using, and an opportunity where it's just you and that loved one. If you want to bring other loved ones in and do a more traditional intervention, that's fine too. But you want to make sure that they're not actively using when you do this, quote, intervention. The key during this whole thing is that you've already set action plans in place and already started to think about different options for this loved one, because we only have a very small window of opportunity if the loved one decides to take your advice and seek help. What's out there in the world as far as treatment? The real trick is finding specific experts in the field of addiction. A lot of us normally would go to our primary doctor, our therapist, a local psychologist. The problem in that is that a lot of our local professionals aren't trained specifically in drug addiction. Most doctors, psychologists, and therapists have only taken 1 or 2 courses in drug addiction. So we want to go to someone who could be a doctor but specializes in addiction. The treatment world is filled with different options, and I'm sure you've heard stuff from rehabs to inpatient to group therapies to AA, and it's hard to kind of figure out really what's best for you and your loved one. So let's talk about the two main differences. There's inpatient and there's outpatient. When we're talking about outpatient, what we're talking about is having your loved one live at home or in a sober living and receive treatment. And there's about 3 or 4 different types of outpatient therapy. One type would be what we call individual therapy. That's more traditional, where your loved one would go and see a therapist once a week or twice a week, talk about their addiction. Outpatient therapy is excellent for assessing a problem. My issue with outpatient therapy is, in addiction, a lot of the studies and research show the magic in getting your loved one to really realize he has a problem and to start working on that is in group therapy. There's a lot of different options as far as group therapy. There's people who go once a week to group therapy, to a local, to a local AA group, or to a local structured group therapy group for substance abuse. And then there's more intense and structured programs. These programs are called IOPs, or day programs, or PHPs. An IOP stands for an individualized outpatient program. A PHP program stands for a partial hospitalization program. And a day program means you're in the program for a day. Now, the 3 of these are a little bit different, so let's talk about them. An IOP, an intensive outpatient program, is one where a patient or a loved one would go and receive individual therapy, group therapy, and substance abuse treatment, meaning education around their substance abuse. Why is this beneficial? A, because they're going to be assessed, they're going to be in a group setting, but they're also going to get the individual care they need. One of the important components of an IOP program, or a day program, or a PHP program is what we look at as accountability. Accountability is a huge, huge part of early recovery. When we talk about accountability, that would be in the form of, say, drug testing, where your loved one at this IOP, PHP, or day program would be able to receive weekly, bi-weekly, or random drug testing, so you could be sure that your loved one is not using drugs and alcohol. And it's also an excellent way for him or her to build the trust back in their relationship with you. The next higher level starts at individual, Then we go to group therapy. We've got IOP therapy, individual outpatient program. Then we look at a day or a PHP program. This is where a loved one would spend 4 to 5 days a week, 6 to 8 hours a day in an intensive program structured setting. This is great for a loved one who really struggles at setting a structure up in their life and really has a hard time getting from the morning to night without using drugs and alcohol. Let's talk about residential. A lot of people think about residential as you send your kid away and they come back and they're cured and the problem's fixed. We understand addiction now is a family disease, and unfortunately, a chronic disease lasts a lifetime. So when they come back from a residential level of care, they're not fixed or cured. We've got wonderful, wonderful treatments for drug addiction, but there's no magic cure, and the family plays a huge role. So residential or inpatient is where you send your loved one away. This is excellent if your loved one just can't stay in recovery on his own and he needs help. This is totally normal. It doesn't mean something's wrong with him. This is not a willpower issue. We understand addiction as a chronic disease. Your loved one might need a higher level and more structure and need to go to an inpatient program. There's many different inpatient programs. The shortest one would be what we call a detox. That's a 3 to 5 to 7 day program where we physically detox your loved one off their drug or alcohol of choice. The next level would be going away for an 18 to 30 day residential program. This is excellent for detoxing a patient and getting them to start learning coping skills and good relapse prevention stuff. From there, we can go on to 60, 90 to a year program. These programs are excellent for getting your loved one to really get the drugs and alcohol out of their system, learn to cope and deal with the real life, and then return home and hopefully continue to work in recovery. So we've talked about a lot of different options with treatment. The most important part is that you're willing to take this step. You're taking action steps to get your loved one the help they need. And the great news is we've got wonderful treatments out there in the field. I'm very excited that you're willing to take the steps to be there for your loved one. For more information or if you need help, please email us at help@matthewshope.org.